Hello, my name is Brian Ramaco, and I'm going to cover treating the pronator teres muscle. This may be relevant to those with carpal tunnel syndrome type symptoms in their hands, such as tingling, weakness, or pain in the first three fingers. Now, while that can be a compression of the median nerve at the wrist or the carpal tunnel, that could also be an issue with the pronator teres, which is way up here, which can also compress the median nerve. So it's something that you can treat. Now you might have a compression of the nerve at the wrist and pronator teres, or maybe all of your symptoms are from the pronator teres. So this is something to keep in mind and to check. This is something simple and you can treat at home. So it doesn't require a carpal tunnel surgery to release the carpal tunnel. Okay, so this muscle basically goes from the bone on the inside, sort of goes across at a 45-degree angle. You actually have two bones in the arm, so it goes to the far bone. So if I were to place my thumb here and have it go across at that 45-degree angle, see, sort of like this, that will be sort of traveling along this muscle, bone and across. Now, if I place my thumb and I push down and I feel a spreading pain down the arm, maybe reproducing your pain, that might be a myofascial trigger point, a muscle knot. If I do feel that spreading pain, try steady pressure. Recreating a pain about 5 out of 10. If you're in the right spot and if the diagnosis is correct, if it is a myofascial trigger point, then within 10 to 30 seconds, maybe 60 seconds, the pain should start to drop. Once it drops, you can try to increase the pressure or find another point and increase the pressure. And of course, the pain goes back up and then the pain drops again, just like the first time. You can basically chase down these trigger points and make them disappear using compression. That type of treatment is called ischemic compression. Very effective for muscle knots. Okay, so assuming it's just tight though, and you haven't found any muscle knots because it might just be tight, then an effective way to sort of relax it is a stretch. I like the pin and stretch strategy. In a pin and stretch strategy, you want to shorten the muscle, then you push on it, pin it down, and then you lengthen the muscle. And so it targets the stretch right into the muscle that you're pinning. So here we know where the muscle is, it's across here. And if you do this, you can feel that muscle as because it's lengthened here and it's shortened here. So as you're doing this, you can feel it basically become taut. So that's the muscle we want to target. So it does help if you can relax the arm, if you can do this with your arm on a table so it can really flop. If you don't have a table, you could use your leg with your sitting. So I can flop it this way, this will shorten the muscle, then push on the muscle, and I flop it this way. Oh, that's a good stretch. And I can hold it for a few seconds, then I can release everything, flop it back, and repeat the process until I feel that the muscle is relaxed. And that's how to pin and stretch the pronator teres muscle. And we've also covered ischemic compression if there's muscle knots in it. And this may help those with carpal tunnel syndrome type symptoms, basically nerve symptoms going down the arm to the hand. It may help anyone who has pain that starts in the forearm and goes towards the hand. It might be muscle-referred pain from the pronator teres. Of course, if those aren't your problems, then this won't help. But my hope is that, well, I don't hope this on anybody. I don't hope anyone has problems. But if this is your problem and you see this video, I hope that this helps. Anyway, cheers. Have a good day.